So the PRAGUE-19 study is a prospective registry, two-center academic registry. And it was conducted because we wanted to test BRS cell bubble stents in STEMI patients, in STEMI settings. We started this registry in December 2012, and this registry wanted to implant BRS cell bubble stents in STEMI patients. We highly selected STEMI patients. This registry had several angiographic and clinical exclusion criteria. So altogether, we implanted BRS cell bubble stents in less than 20% of all STEMI patients during the 3 years period. So we presented today the 5-year follow-up of our patients. We wanted to do this analysis because 3 years ago we showed that after 3 years the BRS cell bubble stents are still present in the vessel wall. So that's why we presented today the 5-year analysis after the stents are completely resorbed. We think that it's extremely important to know clinical and imaging data after the resorption of BRS cell bubble stents. And what we found that after 5 years, the BRS cell bubble stents are completely resorbed. And according to QCA and OCT analysis, there is a stable lumen diameter and lumen area of the treated segments. From the clinical perspective, there was important information that between the 1 year and 5 year of the clinical follow-up, except one sudden death, there were no cardiac events during this period, even the DAPT was stopped after 12 months. Next to the technology, I think the first what is really needed is to select patients. I think that BRS cell bubble stents not are for all patients. We have to select carefully patients, not to put a BRS cell bubble stents into lesion, heavily calcified lesion, into tortuous vessel. So this is the one important issue. According to technology, I think that we need that the new generations of stents will resorb more quickly than the first generation, and of course we have to wait long-term data of all the stents and to carefully follow all the patients. This is an important issue, I think. I strongly believe that this technology has a future. I think that we have, as I said before, we have to select patients. We have to carefully follow all the patients. And for younger people with soft lesions, this technology could be helpful because it can prevent the neoatherosclerosis in the metallic stents, and from the long-term perspective, the patients can have benefit.